Okay, hey everybody. Welcome to this forum that IAG has organized for all of us. Thank you, Sanjay Talur, the president of IAG, for organizing this. Hopefully something good will come out of it today, and even if one person benefits from the knowledge we share today, it would be wonderful. We're at a very odd time of history. Chances are we'll all remember what we were doing spring of 2020 because of this particular episode. Countries like Italy will probably have a hard time recovering for a while. I wonder about our own future and our recovery, but I do honestly believe there's a better future out there. We will overcome this. So let me tell you what we're going to do today. We have a panel of 5 physicians, and each one of those physicians brings a different strength to this panel. Please feel free to send in your questions later on through the YouTube medium, the Facebook, or even you can call, obviously, yeah? We'll try and answer the questions to the best of our abilities. We're obviously practicing physicians. We're trying to help the community, so we may not know everything on every issue, but we promise you we will get back to you with the correct answers. And one thing I need to mention, even before I introduce my panel, is that the opinions we give here are truly ours. They do not reflect on the places we work or we associate with. So keep that in mind. And I would like to introduce Dr. Ravi Patel. He is an emergency room specialist, and he practices out of Prisma Health Systems Lawrence Emergency Room. We have Dr. Nancy Patel, and Dr. Nancy Patel is a pulmonologist, critical care specialist in private practice. Big association is with Prisma Health Systems at the Lawrence Hospital, but she also dabbles at Spartanburg Regional sometimes. We have Dr. Viral Oza, who is new to Greenville. He's a gastroenterologist, an interventional gastroenterologist who's working at Prisma Hospital Systems. Welcome to this panel, Dr. Oza, and he will talk to us about how it impacts physicians and providers beyond the ones that are actively involved. We obviously have Dr. Santosh Bijur, who's a hospitalist who has been working at Spartanburg Regional and Anderson's Regional Hospital. I myself, I'm Vinita Srivastav, and I practice internal medicine, outpatient medicine, and sleep medicine at Peace Medical Centers at our 2 different locations. I'm affiliated with St. Francis and also with Greenville Hospital System. So between all of us, we bring you updates from what Spartanburg Regional might be doing and thinking, Prisma might be thinking and doing, and Anderson. And a little bit of reflection from me from what St. Francis is warning me and telling me about. So now, without much ado, I do really want to go on to getting our panelists to speak on different aspects of the so let me start with you, Nancy. Nancy, what are you seeing? Are you seeing patients already that might have symptoms suggestive? Do you suspect, do we have a scenario bigger than what we think we have?
So yes, we are seeing cases where we are, obviously ruling out COVID-19. The symptoms are somewhat challenging in the patient population that I see on a normal basis, where most of my patients do have shortness of breath, COPD, asthma, etc.
Yes.
So when they come in with their normal flares of, hey, I can't breathe, once again, we do go down the pathway of trying to rule them out. Obviously, testing has been limited, and that's delayed some of the care and some of the problem there. And so I do believe personally that there might be cases out there that just are not being reported because of the delay in the testing.
So for those of you that didn't catch it, that was Dr. Nancy Patel, pulmonologist, critical care, telling us that there is a bigger problem than we imagine. Let me ask a question of Dr. Ravi Patel. Dr. Ravi, what is the emergency rooms doing? Are we in the upstate at a point where we feel comfortable and confident?
Well, I can speak for what we're doing right now as far as Prisma Health. They have a tent set upside at Greenville Memorial, and those folks can go there with an prescription order, and that's all they can test for is COVID-19, which gets sent to DHEC, and it's about a 3 to 5 day turnaround for that test. Now, that's only for symptomatic patients that a doctor deems necessary to get tested for. Now, So all the hospitals are gearing up. Obviously, we spoke earlier that North Greenville is turning into a COVID-19 hospital dedicated to just those patients. So we are gearing up as far as, getting prepared at all the satellites as well.
Okay. At Prisma, at Lawrence, where you're working, you guys are making some additional measures to prepare for those cases, the onslaught of cases that we anticipate?
We are. We're in the process of probably setting up a tent outside as well,
Yeah.
to kind of prevent needless exposure to other staff.
Mhm.
Just to have exposure to staff that's properly protected with gowns and masks and et cetera. So we have an algorithm that we go down as far as who needs to be tested, who needs to be admitted, who can go home safely and isolate themselves, until further testing is available more throughout the PCP's offices and the hospitals. And we have to kind of follow those guidelines.
Santosh, you being a hospitalist at these two different hospitals, you probably have a good idea of what is being admitted and what patients are coming to the hospital, getting admitted. Are you seeing cases where you might think you're dealing with COVID-19? Is that something?
Yes, yeah, we are seeing cases that are what we call PUI, that is patients under investigation.
Yeah.
So if they have minor symptoms in the ER, as Dr. Patel mentioned, that they test them and send them home and ask them to self-quarantine and follow the PPE procedures that they can do at home. If they have moderate symptoms, or if they have comorbid conditions, if they have diabetes, they have COPD, they have any cardiovascular conditions like congestive heart failure, and then they have these symptoms, fever, cough, shortness of breath, sneezing, sort of quote-unquote cold/influenza kind of symptoms, we admit them.
Yes.
Depending on how their respiratory status is, we either put them in intermediate or severe, depending on if they have a severe infection. And then we go follow an algorithm that kind of tells us how we follow the procedure. We have them isolated in one wing of the hospital right now.
Okay.
And well, if we do unfortunately see a surge of cases, we may have to open certain other places in the hospital where we will start.
So for right now, Spartanburg Regional and Anderson have dedicated a floor to COVID-19 suspected patients or patients under investigation, right?
Yes.
And you were talking about North Greenville being dedicated by Prisma as their COVID-19 hospital. So I'm glad certain steps are being made to anticipate and work with that. Dr. Oza, what is you are practicing at Prisma, you are still seeing patients for other conditions. What are you seeing and hearing at the hospital beyond what the physicians that are actively involved?
So, I'm a gastroenterologist, and as a gastroenterologist, what we have done at Prisma in our clinics is we have decided to cancel a lot of the elective cases that are, so for example, things like screening colonoscopies or really any elective cases which don't have to be done in the very quickly or on an emergent basis. And those cases are rescheduled. We're contacting our patients and letting them know. And this is happening, I think, across all specialties, not just gastroenterology specialty. As far as clinics are concerned, I think, again, across all specialties, a lot of providers are shifting towards telehealth. So having a discussion with patients through kind of like what we're doing right now, video, having a conversation with the patients about whatever is going on, whatever their conditions are. And even we are able to do everything, even we can prescribe medications electronically. So it's not really limiting us that much, but yes, it does limit our in-person interaction. That's really necessary to minimize exposure to hospital staff, hospital workers, but also it necessitates minimizing exposure to patients who might be at high risk, who might be coming in. Now, patients who absolutely have to be seen in clinic, we are still seeing them. We just ask that if they are having some of the symptoms of COVID-19, then they let us know up front before they come, so we can triage them appropriately. And if they need to be seen, then we can see them in the right area.
So, Dr. Oza, you're reminding us that if a patient is sick and needs to be seen for a non-emergent procedure, obviously if they have symptoms that suggest COVID-19, inform the doctor that you're doing the procedure with, and you're trying to reschedule totally elective colonoscopies to a future date.
Colonoscopies, endoscopies, everything that's elective.
Colonoscopies, endoscopies, but the other stuff that people need, absolutely, like we were talking, your cancer patient that has to have that stent removed, you're proceeding on with that. Is that correct?
It's also a case-by-case basis. Sometimes you can actually give delay delayed by a couple of weeks. In those cases, yes, we are delaying them.
Yeah.
But if it needs to be done
Then-
sooner rather than later, then we do it in the safest manner possible.
So the basic things that we're all hearing from everybody is, of course, that the hospitals are prepared, that the doctor's offices are prepared. Now, I take care of a good bit of 3,000, close to 3,000 patients in an outpatient setting. So I will tell you guys what I am seeing in the outpatient setting. Obviously, I'm seeing a lot of panic. I have patients that are scared, that are calling me, do I have COVID-19? And they absolutely have no symptom. I'm seeing patients with cold and allergy symptoms who are concerned, do I have COVID-19? And honestly, there's a couple of patients that came in and who did not ask me if they had COVID-19, but when I examined them, I was confident they had COVID-19 or something similar to that. And to give you all an idea, in January, I saw a few cases that I thought were hard to treat, upper respiratory tract infections. Looking back, we might have dealt with COVID-19 at that point. Obviously, I have no basis to say this, but I'm thinking that might have been the case. So in the outpatient setting, I'm seeing patients, but I'm having to make a shift. I'm shifting the way I do it. Every patient that's sick calls our office. We tell them to either come to the office or we're treating them by telehealth. If they come to the office, they're waiting in the car, I examine them in the car or in my contamination room. And if I sense that this could be a positive, I send them to the south deck of Prisma's parking main complex, the 701 Grove Road complex. That's where I've been sending the patients for testing. Obviously, since I've seen and they have a valid order, the south deck physicians are able to perform the tests. But what my suggestion to all my patients has been, call us if you think you have symptoms. Call us. We can talk to you. If you're anxious and worried, call us. We can tell you if you have a reason for concern. But the big thing I want you to take from this is that there is a future out there. Now, I do want to get started with some questions. Are there any obvious questions that have come in? Let me take a look. And remember, guys, please forward your questions. We're here to help you with those questions, very much with those questions. The first question we have from somebody is, do we have enough stocks of hydrochloroquine in the United States? And can this be used as prophylaxis? So I'm going to forward this question to Dr. Nancy, because Dr. Nancy, can you tell us what is the role of chloroquine? And I want you to also touch base, is there any other treatment options that you think are valid in that context?
Sure. So the chloroquine right now is still under an investigation.
Yes.
So right now, as far as getting prophylaxis dose or getting treated with it, truly, I personally do not think that we need to start that process of going to your physician, asking for chloroquine. I think those, yes, will get depleted if we decide to start doing that, if we did that now. I think those cases should be for patients that are actually admitted in the hospital, who are moderate cases and possibly the severe cases. But once again, it's under investigation. Investigational studies take usually a few years to have that produced. The FDA has to be able to regulate that and the public to get that. There's a lot of different phases that it has to go through. So right now, the treatment options are just supportive care. So for mild symptoms, you need to focus on drinking plenty of liquids at home, taking Tylenol, avoiding Motrin, because that's been associated with a little bit of complication with this virus. If your symptoms become moderate, that's when you need to seek medical attention. Usually you start seeing those symptoms in about 4 to 5 days. That's the biggest problem with this virus, is that you can be asymptomatic and shed the virus. So in 4 to 5 days you should see the fever, the cough. Once you start progressing to shortness of breath, that's when it gets concerning. And that usually occurs in about 7 to 8 days. After you progress to that, it can progress very rapidly. You could end up on life support and end up in the ICU with what we call ARDS. That is a condition that we have treated before. It carries a very high mortality rate, about 30 to 40%. Normally with those patients, there's a lot of maneuvers that we do in the ICU as far as changing ventilator settings, as far as paralyzing them, and even proning them. So if you see a lot of these videos and articles that are a lot of pictures online as far as what's going on in Italy, you'll see them proned, and that's just to recruit more of your lung to oxygenate it. This virus causes a inflammatory response, and with that inflammatory response, you get a lot of fluid buildup. And it's almost like, it's in a way almost like you're drowning. And so the membrane that we have, the alveoli, along with the capillaries that usually normally exchange oxygen, we lose that membrane. And in order to protect you and to fix that, we have to put you on life support and give you time to recover. Normal recovery, usually on average for an ARDS patient, is about 14 days, okay? So if you have one patient in the ICU for 14 days, that takes up that bed. And that's why there's a big concern as far as, yes, this virus is potent, but at the same time, it's the resources that are gonna limit us in helping to control this virus. Like you said, most of us are gonna recover, 80%. Are going to recover, you're going to do just fine. This is
That's
not
very important. 80% of us will recover from it.
Exactly.
But we do want to make sure that people are aware why we are talking about this. It's because of those 20% and what she spoke about, the ARDS. That's why we want to talk about it.
About 15% of that 20% will probably just have moderate symptoms, and Dr. Bajor will be handling those patients in the hospital where they'll get a pneumonia, you might end up on a little bit of oxygen, and then you should be discharged home. But that 5% is where the highest mortality comes from, and that's why we need to limit social interaction so that we have enough beds, so that we have enough ventilators, so that we have enough, PPEs, which is the personal protective equipment that, we go through in and out in those rooms. For one patient in the ICU, the amount of times a nurse has to go in, just to go in to turn a pump off, or a respiratory therapist needs to go and change the vent settings on. All those things require equipment for us, and the more we expose ourselves to that, the more this virus will continue to spread. And as far as therapies, like I said before, yes, they are looking at antivirals, yes, they're looking at vaccines, and then chloroquine as well. But once again, this will not really be available to the public, in my mind, as far as just getting it for prophylaxis, because then there'll be a shortage on the patients that truly benefit from it in the ICU or in hospital setting.
So what I'm gathering from what Dr. Nancy spoke about is that out of 100 people, about 80% of us, meaning 8 out of 10 or 80 out of 100, we will be fine. Some of us, out of the 20, will probably end up seeing Dr. Bijur at the hospital because we're sicker than we should be. And they will probably go through you, Ravi, to get there, and hopefully you'll stay safe while doing this. But once the patient gets to Dr. Bijur and the hospitalist, and if they do a great job, and obviously even the best of efforts sometimes doesn't work. If you're older, if you have diabetes that's poorly controlled, if you have congestive heart failure, atrial fibrillation, end-stage renal disease, or you have COPD, you are the high-risk patient. And if you happen to be elderly who lives in assisted living or something of that nature, it's that patient that will probably end up under your care, Dr. Nancy. And we're talking about chloroquine being used for the patients in the hospital, chloroquine being used for the patients that Dr. Nancy Patel will see. Now, the thing about chloroquine is, yes, it is a good drug to help, but let's not overuse it because there's that fear that we will end up in a shortage that will be desperate. So thank you, Dr. Nancy, for that. Now, let me see what other questions I have. Let me ask Dr. Ravi about the emergency room, and if you wanted a test, are you able to get a test?
Same, just like you mentioned, I need an order as well from a physician. So if I wanted to go, if I was exposed to somebody, I would contact a physician and say, hey, I was exposed, I need to get tested, and that way they can quarantine me so I don't expose more patients or vice versa. So that's one of the process. But I did want to mention something about testing. Now, the gold standard testing is the PCR.
Yes.
And that's sent to DHEC, and that's pretty accurate. Okay.
Yeah.
So the problem with mass production of testing is that, like the rapid flu test, the accuracy goes down. Okay?
Yeah.
So, the government doesn't want to put a test out there that's only 50, 60, 70% accurate because it's devastating to say you're positive when you're not.
Yeah.
Because that changes people's lives.
Yes.
So before they put out a test, I think they have to make sure that the test is going to be accurate enough for us to make clinical decisions on. So, I think that's why we're kind of seeing a delay in mass production of these, tests that everybody can do at the offices without having to go through this whole process. But from what I hear, I think Roche, one of the pharmaceutical companies, is working on a 4-hour rapid test. Now, the WHO has a test that they, implement, and the rest of the world's probably using it.
Yeah.
But from what I hear, and I may be wrong on this, but their test is not as accurate. So
from what I'm gathering from what you're saying, if you needed a test, you're probably getting it, but it is the CDC test, the PCR CDC test that we're getting. Companies like LabCorp and Quest are also able to offer, for instance, in our office, I could do a swab and send it to LabCorp, although I have limited number of kits. So, but the most important point that Dr. Nancy made earlier, you come to my office, I see patients with 5, 6 chronic medical problems. So if I were to test you, I would be doing a lot of disservice to those other 5 or 6 patients in the waiting room who have chronic medical problems. And those people are in the waiting room because they're sick with something else or there's an active issue. So yes, it would be a good idea to get tested, but hold your horses, be patient. If you have the symptoms, call your doctor, call your PCP. The PCP will either talk to you, or your PCP will do a televisit, or your PCP will refer you to the 4 big televisit centers in the state of South Carolina. I know Roper St. Francis has a virtual office. I know Prisma has a virtual office. MUSC and McLeod Regional has so we have 4 big regional offices, and I believe if you use COVID-19 as your test code, it is supposed to be a free visit for all of us. So we are in the process of making sure that everybody in our office, when they come in, we talk to them on the phone, we go ahead and do a televisit with them and give them the order, if we deem that necessary, to go to the South Deck 701 Grove Road. So Dr. Ravi, your point is well taken. We understand that there are other test modalities that they're trying out there, but we don't have those quite yet. Now let me ask another question. This is for Dr. Oza. Will garlic, ginger help curing us or help me protect from the virus? I saw lots of videos and messages saying that they are helpful. Also, can I stay in the sun or take a hot bath? Will that help me kill the virus?
There's no data on any of that.
Yes.
So the short answer to that question scientifically is no.
Yeah.
None of those things will help.
So the blunt answer to that question is we have no proof to that extent. But I don't think it hurts to do that. Would we be safe to say that?
You want a sunstroke if it's hot and you're sitting.
I guess that's true.
It can hurt, yes.
I guess that is true, with pollution and the ozone being gone, yeah?
Remember, we are on Facebook Live, YouTube Live. This is being streamed worldwide
Yeah.
right now live.
Yeah.
If somebody in India is watching this, it's almost 44 degrees Celsius there. They go out and lay in the sun, they'll be dehydrated and sick with
Very
something
valid
else pretty
point.
quickly.
Yeah.
Valid point. So
And
do it with caution
And
if
even
you're
with all
doing
that,
it.
even with all that heat,
Yeah.
India still has a lot of infections.
Yes.
So I think what we are seeing is that heat or
Yeah.
in hot temperature
Mm.
doesn't seem to affect this as much as what you would expect.
I think some
Very
of this,
interesting point, yeah.
some of this is based on the fact that in 1980 when the Spanish flu hit,
Yeah.
they did treat people outdoors and they felt that the ultraviolet rays may have helped.
Ah.
Again, these are all scientific studies, so
Yeah.
definitely not. No one is implementing that at the moment, and I don't think it should be advisable.
So certainly our panel doesn't feel compelled to offer that, but like we said, if you feel that it's going to help you, you think it's cautious, as long as it's not behavior that harms somebody else, then we're not going to be able to stop.
I don't think Dr. Patel will be using ginger and garlic in
Yeah.
ICU.
No.
I don't believe that was the
Yeah,
intention of the
it's-
question. That would be.
There's other benefits of those things, and you're certainly welcome.
Yeah. So there's another question I got about ibuprofen and infected by virus, and what is the situation? Can I take ibuprofen if that's what works for my fever?
Okay, so now CDC has pretty much said at this point that there's no clear data
Yeah.
that says that ibuprofen could worsen somebody who has COVID-19 infection.
Yes.
Now, taking into account that, there was again a small study in France where,
Yes.
and in Italy, where they found
Yeah.
some cause and effect when
Yeah.
the patients who had ibuprofen for fever,
Yeah.
they found that they didn't do well because there's some receptors in the lung called ACE2 which get upregulated, and they're concerned that the virus gains entry into these cells via those receptors.
Yeah.
So if that could cause, worsening of the symptoms and, condition of the patient. But no, there's no data to support that. But having said that, I would advise not to take ibuprofen. There are other alternatives like Tylenol and paracetamol in India, and in here acetaminophen that can be used for fever. So yeah, I would not advise using it.
So your advice is, CDC doesn't say that ibuprofen is bad, but you think when you have choices like acetaminophen, which is Tylenol, why not use those first line and then reach out for something like an NSAID? The other question somebody's asked is it safe to consume meat, eggs? Dr. Oza, what do you think?
What do you mean? safe to
Consume meat and
If you have-
eggs.
Yeah, I mean, if you have the infection, if you have symptoms or you don't have symptoms, I don't think.
I just think they're worried about the safety of.
Oh, I think it's pretty safe as long as it's being cooked. I think
Yeah.
it should be okay. I don't think there's any data to support that meat and
Right.
eggs are.
There's no-
Yeah, there's no data.
So I think what Dr. Oza has suggested is there is no reason for us to refrain from eating meat and eggs just because of this, because there's no data or studies. Now, let me ask a question here about, once again to you, Dr. Oza, because this is a question about travel. My in-laws are visiting from India and staying with us now. They're both over 60. What precautions should we take? Will it be safe for them to be here, or should I send them to India? How safe is it to travel now?
So first of all, they're here, so they should be in quarantine, and you guys should be having a social distancing even at home. So maintain the distance 6 feet or more. Number 2, wash your hands and use sanitizers as needed. And number 3, India has just shut down all incoming flights, so they're not going to be able to get back. Even if they're Indian citizens, they can't get back to India. And traveling right now is not recommended. So I think they're here. You just do the best you can and stay indoors and quarantine yourself.
Yeah.
Avoid large groups. Again, like I mentioned earlier, they shouldn't be playing with their grandkids. The kids again are not affected as much as elderly patients are.
Right.
So just routine quarantine measures, hand washing, social distancing, standard.
So you're suggesting definitely no travel to India, this is not the time?
This is not the time to travel. A lot of flights aren't even flying, so
Right.
there's no way to travel, first of all. But even if you did have a way to travel, I would recommend strongly against it.
And of course, all US nationals have been asked to come back.
That's right. As
Yeah.
of Friday, Friday or Thursday, I think the CDC and the government put out, Department of State put out an alert saying they're asking all US citizens to come back home if they can still come back home. If the country's not letting any flights out, or if it's completely sealed, then wherever they are, maintain quarantine where you are.
So obviously, no travel for most of us. We're probably going to try and stay put. The social distancing bit is what we need to be doing.
Correct.
Forget about traveling. So certainly, whoever asked this question, no, it's not a good time for you to send your parents back. Let them be here, follow the social distancing and the basic, simple preventive measures. I don't believe we have touched on the basic preventive measures. I think we need to talk about them, even if we have to repeat ourselves. What are the 4 or 5 things that we can do on a daily basis, Ravi?
Well, the things that most people advocate is obviously the biggest, hand hygiene is the
Yeah.
most, right? So washing your hands frequently.
Yeah.
Doesn't have to be aggressive where you're tearing skin off your hands. And
Yeah.
just rubbing and, 20 seconds
Right.
or so, and making sure you do that properly. Stay, not touching your face.
Yes.
Because that could be a way to introduce the virus into your body.
Yes.
But, just sanitizing, the surfaces, obviously, right? And then, it was a question about hand sanitizer, and there's no access to it, they can't buy it.
Yes.
Most people forget that there's still soap.
Yes.
Soap bars, right?
Yes.
You go to the stores, it's still stocked with soap bars.
Yeah.
No one wants to buy those, but you can wash
At the airports, they are testing, or they are going through a screening questionnaire. So everybody.
You're welcome to go buy that and
Yeah.
use that. So, for the general population, those are the recommendations. Obviously, healthcare workers have different setups. The washing your hands frequently.
Yeah.
Doesn't have to be aggressive where you're tearing skin off your hands. And
Yeah, and
just-
then of course, let's not forget about cough in your elbow, those little
Yeah,
things,
yeah.
those are big, right? Simple things that can take us a long distance. So, Dr. Ravi tells us about the washing your hands, but don't necessarily excoriate them. That's not the aim. Wash it thoroughly. Deodorants and, disinfectants and hand sanitizer, 70% alcohol, use those. don't forget the most important thing is soap and water over and over again. So yes, certainly that's what we should emphasize. In that context, I also had a question. You end up at a grocery store and you don't have hand sanitizer and they don't have hand sanitizer. What is one to do?
Well, I mean, assume that you're contaminated at
Yes.
that point, you know, so the biggest thing is to not touch anything that, or your face or anyone
Yes.
else.
Yeah.
And when you get home, immediately just wash your hands and, you know, decontaminate yourself. So, you know, if they don't have anything, you don't have anything, you're assuming your hands are contaminated.
Yeah, and then you would probably clean up the car surface and stuff
Right,
that you
everything
might
you
have
touched.
touched.
Yep,
Yeah,
exactly.
that is probably true. The other question that we have is, yeah, we did discuss that. Is this more dangerous than SARS or MERS? And what was SARS and MERS? What are coronaviruses? What is this whole thing about? Yeah?
So, coronaviruses is a big family
Yes.
of a virus, okay? The common cold technically fits into that category as well. We've had technically SARS and MERS, which are other strains of the coronavirus, and then the COVID is, of course, now what we're dealing with. SARS and MERS, not to say that they weren't as potent.
Yes.
It's just that I think with those viruses, you're actually able to localize the patients that had symptoms.
Yeah.
And so when you had these measures of social distancing, et cetera, you were able to quarantine them a little faster.
Yeah.
And they tended to have symptoms when they presented. And so it was easier, I believe, to quarantine them.
Yeah.
With COVID,
Mm-hmm.
it's very challenging because you're shedding virus for 4 or 5 days and you have no idea. You have kids who are shedding viruses who are fairly asymptomatic that also are causing this problem. And so that's why I think it escalates so quickly.
Yeah.
Is because of that. Now, whether it's going to be as potent or even more potent, that time will tell.
Yeah.
We don't know for right now, but I think SARS was probably even more deadly than this is right now. But because of the fact that you can't technically know when you have symptoms, I think this can cause devastation as much because we are not social distancing as much as we need to. We really need to concentrate on that.
Yeah.
Sometimes I'm driving home and I see tons of people just driving around still.
Yeah.
You know, certain stores are doing great jobs in barricading and limiting how many people enter the store at one time. So they're doing their job, but we need everybody to do their job. We can't have people on spring break and going to beaches. We can't have that because you come home, you spread it to somebody else, and then that person spreads it to 2 to 3 more people. That's just causing a huge influx of patients that are going to be symptomatic, end up in these hospitals where we do not have the room for everybody to get sick at the same time. And that's what flattening of the curve means, is that
else, and then that
sick
person
right now,
spreads it to 2 to 3 more people. That's just causing a huge influx of patients that are going to be symptomatic, end up in these hospitals where we do not have the room.
Infrastructure to handle such an impact right now. Most of this time that we're having right now truly is the flu season, and with the flu season alone,
Yes.
hospitals are usually about 70 to 80% full.
Yeah.
All right, so if you have that along with the coronavirus, you're just talking about lots of people not being able to be cared for.
Right.
And that's what's going to happen in the future. I mean, you look at Italy, we're pretty close to Italy and their numbers, and right now, just a few days ago, they were taking people off life support. The 80-year-olds were being taken off life support because the chance that they would survive are minimal. So you would much rather technically take care of the 40-year-old that comes in with ARDS than the 80-year-old, which you know is probably going to pass away.
We're doing the best we can.
Exactly.
One good news is 3M and Honeywell are starting to mass produce N95 masks. So that should be good news for all of us. And of course, gowns were also disposable gowns were in shortage, and I believe that there's a urgent supply of that coming in. So when you go to examine that patient in the ICU, what kind of protections are you taking? Are you wearing goggles? What are you doing?
Right, so there's usually the N95 mask, there's a face shield, there's a cap that you wear over your hair. You want to wear your gowns, there's also gloves that you wear, and technically booties that you put on your shoe covers that you put on your feet as well. You could do all that. Now, it's just tricky because if you go in multiple times, every time you come out, it needs to be disposed of, and you're doing intermittent hand washing, hand sanitizer, etc. And just to take off one article, and then you sanitize. So that's where the problem's occurring, is that you're going in, coming out, you may have to go in again, you may have to come out.
Yeah.
And the other issue, of course, is when we're intubating patients. I mean, when you have someone that you have to put on life support, your face is about this close
Yes.
to them. So there is no 6 feet, you can't do it that way. And then the droplets, of course, are going to be very close to you and could get into your eyes, etc. So that's why the N95 masks are so important. There has been shortages as well where people have been taking things from hospitals, and we understand the panic, we understand why you're doing that, but at the same time, if we're not around to protect you, there's going to be a downfall, and it'll affect you at the end. So that's why it's really important to protect your healthcare workers,
Yeah.
regardless of doctor, respiratory therapist, nurse, whoever they are, even the people that go and clean these
Yeah.
rooms afterward, they need to wear these.
Absolutely, the
protective-
sanitation
Yes.
workers, yes.
So
Mhm.
it's very, very important that everyone be protected when they go in so that we can reduce spread.
So the other thing to add to that is, like, since we have an isolated area
Yeah.
where these patients under investigation are
Yes.
housed, we actually reuse our N95
Yeah.
for that day, and then,
Yeah.
besides using adequate precautions like hand washing and the gloves, and so you can reuse them for that period of time and then dispose off, so that way it helps, save.
And your exposure is a little bit more limited, hers are almost, half of them are going to be probably positive
For me-
if they are in ARDS. You are, chances are low, but you still are very close.
Yes, we do a lot of endoscopies
Right.
under the mouth. So yeah, we do wear gloves, same thing,
Yeah.
gown, sometimes shoe covers, face masks. We have N95 respirators as well. But I agree with Dr. Patel that there is limitation in the hospital too, and it's just not Greenville, it's across America.
Yeah.
So be careful and try not to steal stuff from the hospitals.
So we're looking at some more questions, and
I mean, we can help you with that.
yeah,
Right, so one of the common questions we are getting is about as you know, we are heading into the spring with the
Yeah.
pollen season coming in.
yes.
So how do we know that, how do you differentiate, like when somebody is allergic to pollen and having a cough and running nose and all, whether it's allergic or whether it's with the COVID-19,
Yeah.
how to differentiate that?
So that would be a field that I would probably come across more, because these are patients that are traditionally patients of a primary care, and this is your season to get allergies, you're allergic to the pollen out there, and all of a sudden now when you get those pollen symptoms, the achiness that comes along with it, the stuffiness that comes along with it, and little dry cough that comes along with it, scares you. I understand that. So when that happens, think over. Do you have exposure? Have you traveled recently? Have you been on a cruise recently? I mean, those are issues that I would be concerned by. But if you haven't traveled, if you do not have a fever, if you are not feeling terribly bad, chances are it's probably not COVID-19. My suggestion though, still, till we know better, put a mask on. Why? Because if in case you have it, I don't want you to give it to the rest of the family members. Stay home, which means the most people you will infect in a worst case scenario is the 4 other members in your family. Otherwise, you will, if you're out in the crowd, you're infecting far more. So stay home, put a mask on, take your allergy medications, call your doctor, talk to them over the phone, do your televisit with your doctor, and then get their instructions. If they treat you for allergies and you're getting all better, chances are we're okay. But if you start developing a fever, or if you start developing a shortness of breath or something disproportionate, then of course call the doctor back, because chances are now you will be in line for a COVID-19 testing. And obviously, if it gets so bad that you need to head to the emergency room, Dr. Ravi will be ready for you, for people like you. But just remember, when you come there to the emergency room, call in ahead. So we want Dr. Ravi and his team to be mentally prepared to gown up, to dress up, so that they're not walking into a trap. because we need our healthcare workers. And if this goes on for as long as we think it might, we're gonna need them to be in good health, yeah? Any other questions that you have got?
There have been a lot of questions around the chloroquine, like a lot of people are asking,
Right.
as a precaution, should they go ahead and, try to take those things?
Is chloroquine a precautionary measure, like for
No.
malaria, you're taking it once a week? No. No, answer
Not
is
this
no, yeah.
Right.
The answer from the panel is no.
And on the same thing for the immunity, people are asking, are there any vitamin supplements like vitamin C, G, or anything could be taken up? I mean, just to make themselves immune.
Well, they can take anything to boost the immunity, but these are all anecdotal. There's nothing, no science behind it. But there's nothing against not, taking them. They can take them, but that does not mean that they will be protected.
So the Indian population that obviously we are part of has a lot of B12 deficiency and a vitamin D deficiency. Those do have impacts. So obviously our thought process hopefully is take it, it doesn't hurt.
Exactly.
I mean, we're not going to say don't take it, sleep well, eat well, drink and hydrate, yeah?
Use just general, precautions that have been
Yeah.
explained several times. Hand washing, social distancing. These are the things that actually will prevent spread and prevent you from getting the infection.
Yeah.
Rather than just the vitamins, which you can take for other reasons that you've been taking before.
Yeah. Let me pose this question to Dr. Oza. Do you think one can have COVID-19 with no fever?
Yes,
Yeah.
absolutely.
Yeah.
You can have asymptomatic COVID-19. In fact, that's what we're seeing for like the first 3-4 days. You may not even have a fever, yet you still have the infection. So you can still be shedding the virus, what Dr. Patel was saying earlier.
Yes.
But yes, you can absolutely have COVID-19 with no fever, no symptoms.
And if you're very immunocompromised, you may not mount a fever.
You may not mount a fever, and the response when you do get it might be at a lot later stage, a lot worse stage.
Yeah.
But you might need the ventilator, you might need other things.
So yes, you can still have COVID-19 without the fever. Somebody's asking the question, how can I prevent COVID-19? I think once again, let's all reiterate one item so start with you.
Hand washing 20 seconds.
Hand washing 20
every
seconds.
time you touch a surface.
What would you suggest?
Self-quarantine, don't go out unless you absolutely have to.
Yes, social distancing.
Social distancing being your big one, yes, yes.
Social distancing.
And, coughing into your sleeve.
Yeah.
So if you're sneezing, coughing,
Yeah.
you should protect yourself if you don't have a mask.
And then of course, in my case, I would say all of this plus if you think you have COVID-19, put the mask on, call your doctor. That would be the next step.
Correct.
Now the other question that I got was, is there a quick contact number for Greenville citizens to call for any questions or concerns or testing needs? Yes, like I said, there is those 4 teleconferencing sites. Richland Memorial has one, McLeod Regional has one, but the 2 big ones for us are going to be obviously Roper St. Francis' virtual office and Prisma and their virtual office. And I've been told that if you use the code COVID-19, that is no charge. So it's not like they're going to charge you. You can always call. Now don't forget, IAG itself has a website and it has put down a number that you can call for questions. Now if they're health related questions, give those questions to them. They will forward us those questions to the team. And the number I believe is 864-513-1561. Once again, the number is 864-513-1561. Any questions that are asked of that site will be forwarded to one of us and we will reach out to you and reassure you. I'm sure there's more providers in the community, in our networks, who are willing to take on questions. We're here for you, Greenville. We're here for you, upstate. Whether you happen to be Indian or whether you happen to be somebody else who's not Indian and you just want to talk to us, you want to do a teleconference with us, we will reach out to you. We will help you out. These times are tough. These are unusual times. Each one of us went into medicine not for any other reason but to be there for you guys at a situation like that. Am I not wrong?
Absolutely.
So absolutely. So every one of us will be ready. And once again, we have one more question, I suspect, so we can ask the question. Can you ask the question, Sanjay?
Yeah, I mean, there were a couple of questions came in about, visit to the grocery stores and all. So what people are asking is like what hygiene measures they can take, and they have to wear the gloves and mask when they go to the grocery stores, and as well as, what hygiene precautions they need to take when they pick up this stuff and use it at home.
So we've probably gone over this over again, but I think, once again, Ravi, if you don't want to mind repeating what we've discussed.
Sure, the basic principle would be, washing your hands after you touch something, so before and after. And I think if you do that every time, you know, as far as going to the grocery store, if they don't have hand sanitizer, and if you don't have it,
Yeah.
then just assuming your hands are soiled and you come home and wash them, you know,
Yeah.
and wash down everything you touched en route.
Right.
So,
And do talk about that, the box that comes from Amazon, or box that comes from Walmart.com.
so they're saying that, you know, the virus can live on, you know, cardboard, plastic, everything for about 3 days.
Yeah.
So, you know, don't expose everyone to that box, basically. Have one person handle it, you know, and take out the contents, wash your hands in between each procedure.
Yeah.
And, you know, before you grab it, after you grab it, after you take it out, throw it away. That way, you know, you're not exposing anyone else needlessly, and one person has chain of custody of it, basically.
Right. Dr. Nancy, the question also asks is, should we be going to the grocery stores with gloves on and a mask on?
I don't believe that's necessary. If you are away from people at 6 feet, like you're supposed to, the only thing you may want to do is wipe down the cart, make sure that the cart is clean. But remember, this is droplet. Somebody really has to sneeze or cough on you for you to actually be able to get that close to someone. That's that protection.
Yeah.
And it's not the general public that needs to go out with masks, gloves, all that stuff, because you aren't really that close to people if you're doing proper social distancing.
If there's no other questions, I want us to for everybody to over again reiterate, why is this important? Why are we talking about this as a forum today? And why do we not talk about flu? Why?
Well,
Santosh, why?
so this is a new infection, a new disease that has inflicted on us, and now we have to see how we can prevent the spread of it, not just for ourselves, but our family and the world at large. So this infection is not known. There's not much information on it. It's evolving as we go along. So we have to take adequate precaution, and the best precautions we can take is wash our hands, social distancing, clean the surfaces, avoid traveling out, and quarantine yourself at home if not necessary to go out or do anything that is absolutely necessary.
Dr. Oza, what is your thoughts? Why should somebody watching this stop and think today? Besides, of course, panic and fear, which we're all suffering with.
Well, more than anything, yes, it's the unknown, but I think also it's obviously a change in our lives, right? We are doing social distancing. When was the last time we did social distancing? Not in the last 37 years, which is when I was born.
Yeah.
I can't remember this being done my entire lifetime. So I think this is really a once in a generation kind of thing that we are asking everybody to do. The CDC is asking everybody to do. But more than that is what she mentioned earlier. We don't have that many resources. We don't stock up ventilators in the hospital. The government does not have a warehouse somewhere of 1 million ventilators. It doesn't exist. She could probably give the exact numbers of the ICU beds in all of America. Now, if only, like she mentioned, with 1% of 330 million people needed to be admitted.
So you're worried about that 1% of that 330 million.
And I think that's the overall concern is not the 80% that will get better. It's the fact that the 80% can actually spread that.
Mm-hmm.
And then the people who will get sick, those sick patients will end up in the hospital. They can also get all of us sick. So we need to have protection as well. So the resources is an issue. So we have limited resources, and I think that's the biggest concern.
So, Santosh, you felt it's a novel virus. Human beings, we don't have immunity. We don't know how devastating this could be. You feel that the resources are so limited that, hey, if we don't acknowledge this and work with this, we're going to be in trouble. Nancy, why? Why should anybody listening out there stop being cynical and pay attention?
Well, in my profession and what I do, like I said before, I never want to have to choose one life over another.
Yes.
And so that is my biggest concern, is that will I have to choose your mom or your spouse? Who am I going to choose when it comes down to giving life support or those life-saving measures, etc.? I don't want to have to make that decision. That's something that we normally, I never really ever have to do, because we are abundant here. And we are abundant in this country. We have lots of resources. But in a crisis situation like this, it is imperative that everybody stay at home. If you want to I understand staying at home is not easy. We have kids at home now that need to be homeschooled, it's definitely changing everything, but at the same time, you really need to do that in order to just save lives.
Ravi, anything you want to add to what we've discussed? Because Nancy has reiterated, she doesn't want to be in that bad spot of making a choice because resources are so severely limited.
Sure, I think my plea would be to the general public to basically, understand our capacity. And all we're asking is to, let's limit the spread, flatten the curve, so we can adapt and rise to the challenge. We need time. We need time to make more ventilators, more masks. We're smart ways. We're gonna get through it most likely. And
Right.
we just need time to kind of give us time to react to it.
Right. So your suggestion is flatten that curve. If we do the social distancing, if we keep away from people and we don't let it spread, it will still persist in the community, but we will not have that acute peak.
Right.
We will just space it out over a period of time, which will give all of us chances to tackle it better. Now, there's more questions, so let me ask one more question. Yes.
Yeah, so there are a couple questions again came in regarding the testing. So one is, I'll just generalize these questions. So the person that is going to visit the testing center,
Yeah.
how long the testing takes, and do they need to wait? I mean, the person and as well as whoever is accompanying, do they need to wait at the test center till they get the results? And what is the time period to get the results? Right.
So
Yeah,
that's a very good question. So I have sent patients, and first of all, I have done some tests in our office, not necessarily in the office, but in the car. While the patient is parked, I'm dressed, I'm wearing the personal protective equipment. And I've done the test, it's gone to LabCorp, it will be 5 to 7 days before that result comes. So in my case, the wait time was not very long because I put everything else on the back burner, I walked to the patient, I did the test. But most of the people are going to be going to these big testing sites like the 701 Grove Road South Deck parking with your order. When you go there with the order, there's a team that's already masked and gloved, and they do a quick test. They get the stats from you. So it's not a long wait. It's very short. Correct me if I'm wrong. That's what my patient said. It was not a very long wait. The bigger deal was if they showed up without the order to do the test. That's when disaster happens. So, and it takes about 7 days, and the doctor does not get the report. The patient gets called. So just keep in mind, it takes about 7 to 10 days, and the patient gets called, and the doctor does get informed as a secondary. Any other experience on the testing in the hospitals and
No,
elsewhere?
it takes about 3 to 5 days, the real-time PCR testing. But
Yeah.
To add to that, don't just go to these testing centers because you're scared that you might get it. So you don't overwhelm them, because the more people that get tested, it may probably delay the results of the test, because then the CDC and the other organizations that are running these tests will get overwhelmed.
Yeah.
So that's just
Yeah.
one more.
A follow-up on that one, while they are waiting for the test results,
Yeah.
do you all recommend them to be self-quarantined for that period?
Yes, yes.
So the question is, do we self-quarantine the patient while they're waiting on the test? Yeah. Yes, absolutely. Mask on, and you stay in your car. Keep the other members in the car safe. Keep the providers safe.
I think
Yeah.
even
When you go
say,
home.
when you
Even
go
when you go
home,
home, yeah.
until you get the result, you
You will
quarantine
quarantine
yourself.
yourself.
Absolutely.
At least for
absolutely.
14 days.
Self-isolation,
Yes.
essentially.
And then if you don't have any symptoms by then you're okay. But if you, at least for 14 days, since you first thought that you probably had the symptoms, or you were in contact with somebody who had the symptoms, or you traveled to a high risk country. Or
At this point, the algorithm says that if your provider is ordering the test, they have a high suspicion
Right.
that you may have COVID-19. So self-quarantine should be started just based on that, whether the test is
Absolutely.
positive or negative. So.
And when
So-
you are quarantining at home, just to add to that, make sure it's one person that's in contact with that person if they need to be. We have a lot of elderly people who can't really do things for themselves, so it should be just one person in contact if needed to be involved in that care of that individual. It shouldn't be multiple people having to care for that individual.
Absolutely.
practice kind of social distancing at home also.
Yes.
Yeah. So the other question, we have a couple questions on once a person
Yeah.
gets cured, I mean, it's like if somebody has
If a
a
person is
COVID-19
cured.
and he's cured, what are the chances that they are again going to get infected or that's resurfacing?
That's a tough question. The question is about COVID-19 infection, active, treated, and then do we get,
So right now, there's no data, because this is an evolving thing. Likelihood is less, because now you develop immunity and antibodies, but again, there's no data on that to to state whether you get reinfected or not.
There is some information out there, they're saying that there's just like the flu, where there's different strains.
Right.
I believe there's 2 strains to this so far that we know of, that one mutated. So even though you had one, you got over it, and, but there's a possibility to still get the other one. So, we don't know yet.
So there is one other drug-related question. I mean, lyrium, mefloquine. So people are asking, like, do you have any suggestion for mefloquine?
Any ideas on that, Dr. Nancy?
Once again, it's too early to tell. Anything that's investigational right now, you really just need to wait for further recommendations from the FDA, and a lot of it will be used in compassionate use in the sense of, a hospital setting or in an ICU setting where we're going to try to save your life using these medications. We will give you everything, trust me, that we possibly can if you are that sick. We will try our best to do what we can to save your life. We just need time.
All these medications,
Yeah.
if you just take it, they all have side effects.
Right.
Right,
And a lot
and they
of
will
med-
see you after
And
that.
then they'll be seeing me after that with a liver failure.
Nausea, vomiting.
Or
Yeah.
nausea, vomiting, or something along those lines, or
Vision.
kidney failure. So there's, all these drugs have side effects, so don't just take it
Yeah.
because
It's all
you read
about-
something.
Yeah, it's all about risk benefit. That's the way we all practice medicine, is if it benefits you and the risks are minimal, yes, you should take it. But if the risks are low and there's not enough evidence or data to suggest that this is going to help, you shouldn't just go take it.
Right.
So the most important thing we actually could have done the whole time, if we, instead of stressing out about whether chloroquine is available or mefloquine is available, not that I'm downplaying those questions, I think instead the takeaway should be, if we socially isolate, if we keep from the high-risk people, if we do the hand washing, if we stay home and stay put, I honestly think that will reap us much better rewards, because the number of patients will be less, the curve will flatten, we will still have those cases, we'll still have 80% of us get better without any trouble, we'll still have the 20%, but it will be 20% of 100,000, not 20% of a million. Big difference. So we can flatten that curve, and that's the point I want to make over and over again. Yeah?
All right, so this is my question. I mean, it's not
Yes.
from this one. So we talked about all the concerns and all for the general public. So here, you as a physician, how you are all handling this stress and all those things? I'm guessing like there is a lot of stress on the not only physicians, everybody who is working in the medicine field, right? So maybe can you shed some light, like how you're all coping up with that?
And let's all of us give us a sense of what we're feeling. Personally, myself, of course, there is a little bit of fear, and then sometimes there's bravado, and then sometimes there is like a surreal feeling like this can't be. I'm not existing in this time. This is not happening. So when I am scared, it is because when I hear about the cases in Italy, or I hear of the stats in Iran, and I realize, oh my gosh, if we were to follow that trajectory in this country, then I guess there would be a lot of sick ones. And if Governor Newsom of California is right, 25 million will be infected out of the 40 million, then that means every other person will be infected in California. If that is to be true, at those moments when I hear that, it scares me. Not for myself, because hopefully I'm in the lower risk category, but I worry about how it will impact all the people around me, the older friends of mine, patients of mine that have end-stage renal disease, that have COPD, congestive heart failure, patients with atrial fibrillation, or diabetics who are very poorly controlled. I'm not worried about my well-controlled diabetics, so let's not freak out diabetics. I mean, we're talking really badly controlled diabetics. So for those patients I worry about. I also worry about what it is doing to the economy, and by doing something to the economy, it probably is impacting my patients and my staff and the people I know who are hourly wages. If the government doesn't come through, then that is devastating. So I'm scared for that reason. At some points, like I said, I feel very confident that I can help somehow. Like, there are moments, but I need to recognize this is going to be something that's bad, but we're all going to get through it. We just need to be vigilant, but we will get through it. Yep.
Absolutely.
Sunny, what do you think?
Yeah, we will. We just, as Nancy said, we need to flatten the curve. We don't need to overwhelm our healthcare system as well as the providers. It's
So,
like- it's like
how is it
medicine
affecting you? The question was, how is it impacting you? How do you feel about all this?
About,
The whole coronavirus thing?
well, this is where we have to rise to the occasion. This is where
Absolutely.
we have taken the oath, the Hippocrates oath, as physicians, to to help people around. And it's not that this is the only occasion, we have to do it all the time, and we do it all the time. But this is a new disease. You know, people obviously are scared, there's some panic around, but we have to be a little more self-aware, take certain precautions that the CDC has outlined, and that is there on all platforms and social media, etc. And let us do our job. Like someone said, I stay at work so you can stay at home.
Yeah,
So
very
please
well
do that.
said, yeah. Dr. Oza, what are you thinking?
Yeah, the same thing, I think, for me personally, I always, I look at everybody I work with,
Yeah.
whether it's the cleaning staff, whether it's my techs or nurses, and I feel everywhere I look, and whether it's like the food service workers, whether it's, we're in this hotel right now, it's the hotel workers. Yeah, I feel a little stressed like going to work. I mean, you never know when you get infected, it's possible, but you just do the best you can and keep at it. But everybody else around me that I'm surrounded by has way more stresses than I do. So for me, it doesn't, I just look at other people, I'm like, well, I'm in a lot better place, so I just.
That is true, you're counting what you're grateful for essentially, that's wonderful, yeah. Dr. Nancy, what do you think? What are you feeling when this whole thing's unfolding?
So obviously, as a human,
Yeah.
you definitely have anxiety. You
Yeah.
definitely have fears.
Yeah.
And we are exposed to things like this. But I think, being part of a two-physician household,
Yeah.
being in the front line, both of us being in the front line, I think the biggest concern is what if either one of us gets sick or both of us get sick. And I think there's lots of situations like that with other healthcare providers, whether you're a nurse, respiratory therapist, like I said, that raises that concern of what if I become exposed and I get sick?
Yeah.
And I think as healthcare providers, we may be more susceptible in the front line, especially to getting sicker than the normal public technically would, because possibly we're being exposed to more of the virus. So the question I think that always weighs on my mind is what's going to happen to my kids and stuff like that. And hopefully, at the end of the day, I pray. I just kind of leave it up to God, and whatever happens will happen, because that's all you can really say to yourself. So I usually just look to my faith and try to find comfort there.
Yeah.
Because in times of crisis, I think it's important to pray,
Yes.
to pray for yourself, to pray for other family members, to pray for people that you don't even know, and
Right.
to pray for this country. We're going through a crisis. Hasn't happened for a very long time, so we really need to just focus on what we can do and try to control the fears by preparing and making sure that you're doing your part, like I said before.
Ravi, any thoughts on that?
Yeah, I think obviously in my field, being a ER doc, the stress is the nature of my employment or my job basically. So, whether it's, I may contract some sort of HIV, hepatitis from a needle stick, or, if we have cures for it. I think the biggest anxiety with this is that, it's a new virus and, we don't know what we don't know, so that's the anxiety of it. On a personal level, I agree with my wife. I think that, both of us having this such high exposure, we worry about our family, obviously. So, we try to do what we can to reduce our contact, bringing things home or washing our hands, taking showers, stuff like that too. But, at the end of the day, you have your personal life and you have your professional life. So, and, we gotta work out a balance with that.
So I think we're going to come to a conclusion on this one, but I would like to look out for the optimism in this. One, apparently with all these restrictions, the water in Venice is cleaner. We're listening to the birds more. We're staying home. We're spending time with our families. We're educating ourselves better. So there is some silver lining in all of this. We hopefully will be better prepared than ever before for another pandemic going forward in the future. Mankind will make sure we're prepared, right? So that those are the good things that came out of this. But remember, 80 out of 100, we will get the coronavirus. We will be devastated by the news. We will self-isolate, but we will get over it. The problem will be if we don't socially isolate ourselves and self-isolate, then we'll spread it to somebody that is at high risk. But the bottom line is 80% of us will be fine. And most of the young ones, as long as they do their precautions, we should be fine. So take hope in that. It is tough times, but it calls on us to reach down deep, for us as providers and physicians to do more than we've ever done, and for the rest of us as the audience to stay positive and do the right thing by other people's. Count your blessings. And at this point, I would like to thank IAG President Dr. Mr. Sanjay Tellur for organizing this. Very noble. He's channeling his positive energies with his team, and I know Shiva and Ram have been here, and they've been very valuable in transferring the questions and making sure this video feed gets to you guys. So I want to have Sanjay say a few words. Sanjay, please, would you like to conclude?
Yep. Okay.
That's okay.
I would just like to take a moment to express our sincere thanks to all of you. I mean, and you don't know how much this means to the entire community, because everyone is in a very panic and a scared mode. So what my urge to the community is, don't get panicked. I mean, this is not the time to get panicked. That's why we are all rallying. I mean, see the support that you have here, right? So we are as an IAG, we are putting you all the resources to be helpful. One is like if you go on to the IAG website, you would see a COVID-19 page on our IAG website. So we are trying to bring all the reliable sources like the CDC, WHO, the SCDHEC, even the school, and plus all the other communications, because we have also teamed up with Indian Consulate in Atlanta. They're also sending us all the travel advisories and everything, but the Indian government is taking up these measures. So as we get those posting, we are also putting those things on the website. In addition to that, as Vinita was saying, we are extending our helpline now to include some of health-related questions too. I mean, of course, this is not an emergency helpline. This is just if you have any questions and all those things, you can call us on 864-513-1561. I will repeat again. It's 864-513-1561. You can also call us on this line. And then, as we have tagged up with several of the physicians in the community, so we will be hooking you up with one of those physicians, to get the required answer for you. So we all are here together. So we all have to get through this rough phase. So so stay safe. Give the best of your time to your family, and try to be safe in this difficult time. And again, thanks, Dr. Vinita, coordinating this panel. And thanks, Dr. Santosh Bijur for your time, and Dr. Ochab, for your time, Dr. Nancy and Dr. Patel. Thank you very much. Thank you.
We thank you.
Thank you.
All right.